All right, ever wonder why some plastic surgery results look great, they're effortless, and then others are tight or unnatural or just off? You know, the difference isn't luck. The difference generally comes down to design and execution. You know, because the truth is, really great results are engineered long before a patient ever enters the operating room. I'm Alex Campbell. I'm a board-certified plastic surgeon. I'm co-founder of Premium Care Plastic Surgery here in Cartagena, Colombia. And in this episode, we want to explain why surgical outcomes are never accidental and why design and the setup for success before surgery means so much more than most patients realize. So most patients see before and after photos, they see Instagram posts, they see TikTok videos, you know, procedure names and trends, deep plane facelift, 360 liposuction, mommy makeover, HD liposuction, etc., etc. You know, but what they're not seeing are really the key factors that go behind surgery for real. You know, the elements that have got to all come together prior to enter the operating room to set us up for success. You know, plastic surgery is not easy. It's not easy to take a part of the body and do surgery on it and have it look better and have it be uncomplicated. It's actually tremendously complex and a lot can go wrong. So when you enter the operating room, it's game time. You've got to be ready and you've got to have everything in order to optimize your chances for a great outcome. That means accurate understanding of what you're dealing with, a correct, you know, clear picture of the problem. It means a great plan for solving that problem in a predictable fashion. And it means having a great team around you to get it done. So those are the things really that have got to happen, you know, I think for the best outcome. So when you talk about, you know, sort of diagnosis, you gotta, you know, everyone comes in with a problem, right? You know, their face is droopy or their breasts are droopy or they don't like something about their nose or what have you. And it's not like, oh, you need a facelift or you need a rhinoplasty or you need a breast lift or whatever. You've got to really understand what's happening, you know, and methodically kind of dissect the anatomy, dissect what's bothering the patient, and dissect what will make them happy. You know, the way I term it to patients is they say, what do I need? I say, we don't need anything, you know. Of course we don't need anything. Well, what do you want? Well, my breasts are droopy. I don't like the way I look in my dresses after I had kids. My nose sticks out in photos. It bothers me when I'm on the video and my grandson's making a comment about my neck. You know, those are all the problems that people really come with. And so, you know, if there are droopy breasts, that needs a breast lift. If there's sagginess in the face, maybe it needs a deep plane facelift. But we've got to break the problems down specifically, you know, so just because someone wants to look a little bit better doesn't mean they need filler. You know, if they go to the dermatologist, maybe they keep getting filled and then they end up with a deep puffy face. Doesn't mean they need a facelift either, you know, but if they've got descent and loss of volume, then perhaps a deep plane facelift and facial fat grafting is the solution for that problem. Now, when you're looking at that, you got to look at what's around it too. What's happening with the eyes, what's happening with the brow, you know, the skin, the volume, etc., so that you can come up with the most accurate diagnosis, and that allows you to come up with the best plan. So there is no one size fits all. Every patient's different, every problem's different, and assessing that accurately and thoroughly up front is the key first step. The second step is going to be really the design of the procedure. You know, surgery is not a single movement. It's a big sequence, you know, of maneuvers that have to happen. And so there's a bunch of things that are happening, a bunch of decisions we're making, you know, constantly during surgery. How do we tailor this incision to make the scar as discreet as possible? What's the depth of our dissection? How much blood supply do we preserve, you know, to keep the tissue healthy while moving it? What vector do we lift in? How much tension do we use? How do we redistribute that tension? How do we fixate it? How do we do this efficiently? What order do we do things in? There's these hundreds and hundreds of things that are happening during a surgery, especially a complex combination one. And so it's really kind of like a symphony to put everything together and sequence things together to make it happen. And we're making hundreds of decisions, and the results of those decisions are critical. They're going to determine if it's successful or not. Does it look good or not? Does it have a complication or not? So great design of the procedure and then execution of that is critical in our field. And so, I've had patients before, they say, oh, you're an artist, you're an artist. And I would defend against that, or I'd kind of rebuff that at first, because I thought, I can't really even draw very well. I'd say, I'm not really an artist, I can't draw. I'm like an anatomist, or an architect, or an engineer, because that's the way I think of we're structurally changing anatomy to affect a result. And then as I got to know a little bit about art and certain artists, I learned that actually the great artists are very intentional in what they're doing. So they don't sit down and just paint a beautiful painting. They often spend a lot of time prior to that event sketching out drafts, dealing with proportions, measuring things out, using all kinds of tricks to get things to look good, have the human form look correct, etc. And so as I learned about that, I thought, gosh, this is a lot like that. Plastic surgery is like that, because we've got to understand all the elements at play. We've got to design out very specific movements to change the way an anatomy is, to make it look better and to achieve the result. And like an artist, at the end of the day, it just has to look good. That's the bottom line. It's got to look good, and it's got to look beautiful, and it's got to solve the problem of the patient. So, understanding the problem, affecting the right plan, and designing that great, is what sets you up. So then, beyond the great diagnosis, great design, is the system that you live in, that affects your result. And this is a lesson I learned way back in training, is that no matter how good you are, a great system around you is going to make you a lot better, and is often the key to success, in a big operation. And so consistency doesn't come from just being good, from just having talent. It comes from repetition and discipline and refinement and structured protocols. And so, surgery is complicated, healthcare is complicated, it's inherently risky, so you've got to have the full deal in terms of preoperative assessment, anesthesia planning, operative planning, the intraoperative sequence with instruments, personnel, medications, etc. The postoperative period is critical, with nursing and rehabilitation and postoperative, wound care management and all that sort of stuff. And so it's tremendously complex, and so you need professionals in a system with great protocols to make that happen. This is especially true in what we do in medical tourism, because we have the added complexity that people are traveling for surgery, they're having surgery here, they're recovering here, and then they're traveling back home. And so, with us, we've got to have systems that cover all of this completely. They got to be precise, and they've got to do that in a way that's reassuring and comfortable and even enjoyable, for patients. And so, here I've got to give a huge amount of credit to our team that participates, and that together we create this system of care for our patients, which we're quite proud of, because there's so many people that go into it. When people are going to have surgery with us, they'll contact us. That means patient coordinators are taking them through, the preoperative evaluation, connecting them with plastic surgeons for consults, setting up all their logistics to come. When they're here, there's a whole administrative side of things. There's surgery, there's anesthesia, there's a big team in the operating room. And then there's the post-op care, which is nursing and house staff and nutritionists and therapists and the rest. And so when all of us do our part, and that synergizes together, to our world of care, that creates a system that embraces a patient and takes care of everything. And so it takes a lot of work, it takes a lot of heart and effort, and it takes a lot of caring, and because you simply cannot improvise excellence. So when surgery and results come out looking effortless, it's because all these things have come together. And then it's also because surgery respects structure, and the surgeon has good taste, quite frankly. And so, in a facelift, we're not trying to make someone, look like a movie star. We're trying to reset anatomy that's distended. We're trying to restore volume, and we're trying to make them look like themselves, but 10 to 15 years ago. I always say the post-op, you should look like yourself, 10 to 15 years younger, and not look like you had surgery. But when we put the pre-op next to the post-op, you say, wow, that is a great facelift. And that's what we're going for. Refreshed and natural. Mommy makeovers, we're going to restore someone's figure. We want them to look great in that bikini. We want them to look natural, not look like they had surgery. Rhinoplasties, you're not trying to give someone some influencer's filtered nose from Instagram. We're trying to take away distracting elements that bother the patient, make the nose stick out so we can make it more delicate and refined, push it back out of the picture and let the eyes shine through. These are all taste issues, they're all selection issues, and they're execution issues. And so we want patients after surgery to have people say, you look great, you look refreshed, rather than, you look different, did you have something done? That sort of approach and that sort of natural easiness about a result and really getting rid of the patient's problem is really the definition of success, I think, with us. So when you look at before and after photos, when you look at people that have had plastic surgery, you can think about this and think, were these results that were engineered? Was this a plan that was meticulously put together and executed into such a way that I just love how it looks? Or was it improvised? Is it kind of thrown together in some way, or maybe suboptimally performed, which leads then to a suboptimal result? So, great results really are not an accident. They're designed, they're structured, and they're intentional. And so I think that's where we'll close today. I hope this is, sheds a bit of light on our approach to getting great results and is helpful to people who might be, thinking about these types of procedures. So thanks for joining us, thanks for listening, and we will see you here next time on The Surgeon's Tape.